Hello, Research in Color mentees, mentors, and all of our supporters. My name is Precious Fasakin. I am a fellow of the NYU PhD Excellence Initiative, and for the past several months, I've been so graciously mentored by Dr. Subha Mani of Fordham University. Today, it is my absolute pleasure and privilege to share my research on the socioeconomic gradients and risk-taking behavior within Nigeria. The background of this project draws on the connection between individual wealth and sexual risk factors that have long been of interest to both researchers and policymakers alike. In the early years of the progression of the HIV and AIDS epidemic in sub-Saharan Africa, economic status was positively correlated with HIV infection rates. However, at the individual and household level, this pattern is rather mixed. There has been limited work centering the relationship between socioeconomic status and sexual risk-taking behavior itself. This is the gap in the literature this project aims to begin to fill. The primary objective of this project is to analyze and document the socioeconomic gradient of sexual behaviors of women in the context of Nigeria. Within the parameters of this paper, I define socioeconomic gradients as the graded relationship between social status and sexual behaviors and attitudes, in which each step up the hierarchy of social stratification tends to be associated with certain sexual behaviors and attitudes. The primary research question at hand is, how does sexual risk behavior vary based upon socioeconomic status, if at all? The data utilized for this project was the 2018 Demographic Health Surveys of Nigeria, in which over 41,000 female respondents were interviewed between the ages of 15 and 49. Sexual behavior is defined through the data as condom use, lifetime number of sexual partners, age at first intercourse, and several attitudes pertaining to sexual behavior. For example, do women feel justified in asking their partner to utilize a condom? Wealth quintiles were constructed by the DHS on the basis of several factors, including sources of drinking water, types of cooking fuel, household assets, and of course, all of these distinctions were made with urban and rural contexts applied. Here we have the summary statistics in which the socioeconomic quintiles, which are so foundational to this project, have been applied to the data. Quintile number 1 represents the poorest of the group, and quintile number 5, our top quintile, represents the richest. Panel A represents our variables for sexual behaviors. Panel B represents our variables for sexual attitudes. I have applied asterisks to variables which are yes or no binary variables as well. And here in panel C, we have our demographic controls in which we've taken account of age, years of education, and of course, ethnicity and religion. Our empirical strategy here is a standard linear regression model used to analyze the relationship between sexual risk-taking behaviors and socioeconomic status. Here is our main model. S represents the outcome variables for sexually risky behavior previously defined. Delta is the magnitude of the gradient for the kth quintile Q, expressed as the size of the difference in mean sexual behavior outcomes obtained by wealth quintile Q relative to the top quintile, in this case quintile number 5, our excluded category. X represents the full range of demographic controls applied. Here we have our results for our primary regression. I've gone ahead and highlighted several outcomes that I viewed as critical to this project. Here in column 1, we can see that women of the first or poorest quintile were 20% less likely to utilize a condom in comparison to women within the 5th or richest quintile. In column number 2, the same group of women would have less than half the number of lifetime sexual partners as opposed to their counterparts in the 5th wealth quintile. In our 5th column, this is an attitude question in which women were asked if they felt justified in asking their partner to utilize a condom. Women within the first or poorest quintile were 11% less likely as opposed to women in the 5th quintile. And in our final column, we have another attitude question pertaining to whether a woman is justified in asking her partner to use a condom if he has been diagnosed with an STI. Women of the first quintile were 4% less likely to agree with this statement as opposed to their counterparts in the 5th or richest quintile. Our key findings. Women of socioeconomic quintile number 1 indicated the most opposing or negative attitudes of the sample towards refusal of sex, asking their partner to use a condom, and belief that women are justified in asking their partner to use a condom if their husband has been diagnosed with an STI. These women are also least likely to use a condom, on average 20% less likely than women of the richest or 5th quintile. However, women of the 5th quintile, on average, had twice the number of sexual partners in their lifetime as opposed to women of the bottom quintile. They also had the highest rates of condom use within all wealth quintiles. The analysis of socioeconomic gradients in behaviors and attitudes point to several important and applicable findings. First, women in the lowest socioeconomic quintile of the sample display the most stratified outcomes and attitudes, and were least likely to refuse sex, ask their partners to use a condom, and to ask their husbands to wear a condom with knowledge of an STI. Second, the gradient in sexual attitudes is consistently steep. But third, the sexual risk taking behavior gradient is notably steeper. This is why the distinction between behavior and attitude is so critical to this project. Further exploration into the socioeconomic gradient in sexual behavior of men would help to create a more complete picture of the variations in behavior impacted by wealth that are present in Nigeria. And of course, I have my sources. Thank you so much for listening to my presentation, and advanced thanks to Research in Color Foundation and of course, Dr. Subhamani for her endless support and mentorship.